So part of healthy aging, when we think about it from a nutritional standpoint, is making sure that we're meeting all of the needs of that new life stage. And so we're thinking about it in the puppy exam, we're thinking about growth. And then as that animal ages into their senior years, we're thinking about how do we need to modify the diet or modify the activity level to meet that new set of challenges that that life stage will bring.
Hey everybody, welcome back to Vetfolio Voice. This episode is sponsored by Freshpet and features Dr. Lisa Weith, who joined me live on the soundstage at VMX to talk about nutrition and how it relates to healthy aging. These recordings at VMX are some of my favorite. I love, one, getting the chance to talk in person, but two, being able to bring not only my questions to the conversation, but your questions as well. We got a couple in at the end of this episode. So big thank you to anyone who joined us live for this recording. It was a really great conversation. We got into some nitty-gritty details about the different nutrients that make up a balanced diet. And when I was talking to one of my teammates from Vetfolio afterwards, I said something along the lines of, man, I wish more pet owners knew the level of detail we go into to try and take the best care of their pets. Not just that this type of research into the different nutrients and how they affect different body systems is being done, but how many of us are showing up to learn about it and stay up to date to support our patients in the best way we know how. Anyhow, back to the conversation at hand. Dr. Weith was a phenomenal guest. Like I said, lots of information here. She laid it out in a way that was very practical, very applicable, very understandable. I'll let the conversation speak for itself. Let me go ahead and introduce her so you can hear it. Dr. Lisa Weith earned her veterinary degree from the University of California, Davis School of Veterinary Medicine in 2002, followed by a residency in clinical nutrition at the same institution. She's been a board-certified veterinary nutritionist since 2007, providing specialized nutrition consultations both in person and via telemedicine to caregivers and veterinarians worldwide. In her role at Freshpet, Head of Veterinary Research and Communications, Dr. Weith provides clinical nutrition leadership across research and development and new product development, and communicates outcomes of Freshpet's past, ongoing, and future research initiatives. She's authored numerous articles on pet health and nutrition, is an active lecturer at various veterinary conferences, and sits on the executive board for the American Association of Veterinary Nutrition. All right, let's go ahead and get into our episode.
Nutrition is the cornerstone of our patients' health and happiness. The veterinary healthcare team should be the ultimate source for top-notch pet nutrition info. When clients see how the right diet helps their pets stay healthy and happy, they visit us more often. Remember, good nutrition is essential. It's smart business and great medicine. Enroll in the NAVC Pet Nutrition Coach certification today on vetfolio.com.
Dr. Weith, thank you so much for joining me. So we're talking about healthy aging. That's a big topic. Let's start with a big question. What is healthy aging? What do we mean by healthy aging?
I think healthy aging starts from puppyhood, honestly. So healthy aging is how the system changes at each course of life. So from growing puppies to healthy adults to older adults to senior and geriatrics, the body's going to change, and healthy aging is just adapting and modifying the diet along the way to make sure that we're optimizing intake to meet each of the demands of those life stages. You know, you think about healthy aging, not just when you've got a senior pet and you've got that senior dog or cat in your exam room, but we should really think about healthy aging and setting up a system from those first puppy kitten appointments to think about how this system is going to change over time. Each life stage, growth, adult, young adult, older adult, senior to a geriatric, brings with it new sets of challenges. And so we need to be thinking about, how are those challenges going to impact your patient?
Absolutely. If I'm hearing you correctly, it sounds like we're starting from a young age and just considering the different health requirements that would be something that would be important to consider at each life stage.
Yeah, exactly. So part of healthy aging, when we think about it from a nutritional standpoint, is making sure that we're meeting all of the needs of that new life stage. And so we're thinking about it in the puppy exam, we're thinking about growth. And then as that animal ages into their senior years, we're thinking about how do we need to modify the diet or modify the activity level to meet that new set of challenges that that life stage will bring.
And, when we're thinking about considerations, particularly around nutrition, when we're considering healthy aging and different requirements at different life stages, one of the big topics of conversation more recently in the realm of nutrition has been microbiome. So what do we know currently about the microbiome and its influence on overall health and healthy aging?
Yeah, so the microbiome has a lot of different roles within the body. And I think of the microbiome, whether it's the gastrointestinal tract, whether it's the skin microbiome. Now they're talking about the brain and the urinary system's microbiome. So the body is not sterile. And so we need to think about the microbiome is a population of bacteria, yeast that live and support the body. So we need to make sure we're thinking about supporting and nourishing the healthy microbiome, because those bacteria will create compounds that nourish the intestinal cells or may nourish the skin cells and help protect against potentially pathogenic changes. With aging, some of that microbiome may change. So some of the diversity of species may change as animals age. Some of the physiology of the gastrointestinal tract can change with aging. Then that's going to impact the microbiome. And again, we're thinking about how do we help these commensal organisms, these beneficial bacteria, to help support that animal. Again, healthy aging at any life stage, really.
Do we know any of those answers of how do we support these beneficial bacteria? And I know it's another big question because from what I understand it, and feel free to correct me, that there's a focus not only on the actual organisms present, but what function they're serving. I guess I'm talking about GI health overall, because that's just what comes to mind when I'm thinking of microbiome. Do we have any of those answers thus far?
So I will say that I am not a gastroenterologist. So that's why my kind of caveat is I'm a nutritionist. So I think about how to support what are the nutritional requirements of the individual dog or cat. But we're learning so much about the microbiome and how it impacts that nutrient utilization, how it impacts the function of the gastrointestinal tract. And so definitely I would defer to my, gastroenterology, internal medicine colleagues for more detailed answers on the microbiome. So I'll give you my kind of nutritionist simplified, simplistic view of it. So again, these are bacteria that we need a diversity of bacteria. So I think of it like an ecosystem, whether you're in a rainforest or a desert ecosystem or an ocean ecosystem, you need to have some key species in the right places in the right amounts to help support and maintain the health of that ecosystem. And so that's really what the microbiome is doing, is we've got beneficial bacteria that are helping nourish and support, whether it's something like bifidobacter or lactobacillus. We think of Clostridia as being, potentially pathogenic, but there are some forms of Clostridia that help recycle bile salts that have a beneficial role. And the way I think about the microbiome is even those species that we think of as potentially harmful if they overgrow must serve a purpose. Just like mosquitoes serve a purpose and fleas serve a purpose. And even though we're trying to protect our pets and our patients against those because they can bring pathogens, they serve a role in the ecosystem. So we don't want to necessarily eliminate them completely from the earth. We don't want to necessarily eliminate certain bacteria from the gastrointestinal tract unless it shouldn't be there in the first place. So I would say, pathogenic Salmonella or E. coli we don't want there. But ways that we can support the microbiome, the healthy microbiome, what may help prevent some of those bacteria from taking hold.
When we think of gastroenterology and nutrition, like those being very complementary when we're uncovering new things about the microbiome to say, this is what should be here, this is the function that it serves. And then, to your point, how do we use nutrition to support that? The diversity that we need, the types of organisms and or the functions that those organisms are serving.
Yeah, and I would also add that we're still in the learning stages for this too, because there are certain bacteria that will only exist in the gastrointestinal tract and in the crypts and in the deep recesses of the gastrointestinal tract that we may not be able to find in a stool sample or a direct collection. So I also think about the gastrointestinal tract as we're trying to identify like the Mariana Trench. We know it's there, we know there's life there, but it's hard to get equipment there, and it's hard to bring those species up to the surface or more surface levels and have them survive long enough for us to learn about them. And so our microbiome it's complex, and we're just learning about it. So going back to healthy aging, if we think about how do we support the integrity of the gastrointestinal tract so that it optimizes function, whether it's absorptive capacity, whether it's those microbiome preventing pathogenic bacteria from taking hold, or maybe these low-level bacteria that at, decimals of percentages in population are fine, but when they become 1% or 10%, that's where we start to have a problem.
And, I think just us having this type of a conversation right now really demonstrates the shift that has happened when we're talking about healthy aging, when we're talking about nutrition. Can you elaborate on that a little bit? How have your conversations around nutrition, maybe both with veterinary professionals and with clients, changed over, I guess, probably more recently, where we've started to have more of these conversations?
Yeah, so I love that we're having the nutrition conversation. So my background is I went into general practice 24 years ago is when I graduated from vet school. When I was in general practice, I did a little bit of everything, but my passion and what I really loved was having those conversations with the owners about how do you modify the diet to treat food allergies or renal disease, manage renal disease, or to maintain healthy weight. So I always incorporated those conversations with my clients, and I went back and did my specialty training so that I could have a better understanding and be more knowledgeable in those conversations and help other veterinarians have those conversations. So I will say my answer 20 years ago and 10 years ago would be different than my answer today, because when I first went down this path, there weren't a lot of nutritionists talking to veterinarians outside of vet schools or pet food companies. And so I love that we're having this focus of healthy diets and what does it mean to have healthy aging from a human perspective, from a pet perspective, thinking about what's going into the diet and how that impacts the whole system. Like, I love that I feel like we're having more and more of those conversations. And definitely within the last, I'd say 5 to 10 years, I've had more veterinarians reaching out, wanting to know more, which is great because they're clients, they're pet owners, and those pet parents want to know more.
Sure. So it sounds like some of the difference in the conversation is just that we're having it at all.
Exactly. Like, I feel like nutrition, again, aside from, I know our topic is healthy aging, but I would encourage all of the veterinarians and kind of support staff and technicians in the audience that you should be having a nutrition conversation at every visit. It doesn't have to be long. It just, are you feeding a complete and balanced diet, and what amounts? So just some of the basics, especially as animals get older, because some of the challenges we see, things like weight gain, maybe skin and coat changes. With age, we know that skin loses some elasticity. We know that ceramide production changes with age. Any of you who are past probably like the 40-year mark in your own lives are probably noticing some of that change too. So it happens in our pets. And so we need to think about, is this a normal part of aging? Well, yes, things don't work as well as you get towards the kind of sunset of your life as you were at the sunrise of your life. But there are ways that we can modify the diet, and we can modify the kind of the husbandry, the kind of how we're working with those dogs and cats to really maintain good, healthy function for as long as possible.
Yes. Can we just clarify that over the 40-year mark in our own lives is not qualifying the sunset by any means?
No. But I'm saying that things change.
No, I understand.
No, hopefully, I keep telling my kids that, I'm only at the halfway point. I turned 50 last year, and I'm like, I'm at the halfway point. So expect for me to be there nagging you.
Not going anywhere.
Anytime soon.
But I do understand what you're saying. When we're talking about our pets and making sure that, that they're aging healthfully, what are some of the ways that we are manipulating, modifying the nutrients that we're feeding? I guess more so, what are some nutrients that we know are important, and what are some of the questions we're still trying to answer about what modifications to make with aging?
So I think the two big categories that we know about are just general calorie intake. We know that if we maintain a moderate caloric intake and a lean body weight in a dog, we can help them live longer. That was a really good lifespan study that was published 25 years ago that showed dogs that were, and it gets misrepresented as restricted fed, but they really didn't restrict the leaner dogs. They just allowed the heavier dogs to overeat.
Got it.
So
Okay.
they had paired litter mates. One half of the pair was allowed to eat whatever it wanted until it maintained about a 6 to 7 out of 9 body condition. So really just 15% overweight, not even obese, really just overweight. And I would say and it was Labradors. So a 6 to 7 out of 9 Labrador, most people would think of as like breed standard,
Yeah.
even though it's a little bit heavy. And then what they did is their litter mate was restricted to 75% of what the other one ate. So they had
Okay.
their control population and their test population. So control was just 75% of what the test population ate. So not restricted, just not allowed to overeat and became overweight. The dogs that were leaner lived about 2 years longer than their brothers or sisters. They had a delayed onset of orthopedic disease and needing treatment for their orthopedic disease. So even if they had radiographic evidence of osteoarthritis, they didn't need treatment for it. So number one change we can make is just maintaining good body weight, which is also why I think of healthy aging starts at a young age, because most of our dogs and cats, when they're about 1 year of age, you can say if it's a Great Dane, maybe it's a year and a half, but they're pretty close to their ideal body weight for their size.
Sure.
So if you look at the weight at about a year and a half, that's what that ideal weight should be. And if it starts to creep up, then we need to talk to the owners about how do we modify it, because 15% overweight is not that much. And so if there's a way that we can directly intervene and help our pets live 2 years longer, I think everybody would do that.
Yeah. Yeah. It really is a powerful statistic to say, if you can, in many cases, have an extra 2 years with your pet. I mean, I don't know many people who wouldn't want to jump on that and say, how do I make it work? And I think of, some of I have a Labrador. He likes to eat.
They all do.
Yes, they do. Yes, they do.
That's a whole other topic about Labradors and their appetites.
Yes. Oh my goodness. And, I think it would be very easy to let him overeat. And yet I think of myself going, I know what to look for. And I know some of the tricks to help keep him lean, yet not, break into the food bowl and all this kind of stuff. But that's not top of mind. It's top of mind for me because this is what I do all the time, but not necessarily for pet owners that we're talking to. So I think that kind of emphasizes the importance of having the conversation about maintaining that lean body weight as a key component of healthy aging.
Yeah. So I'd say maintaining a lean body weight and maintaining that kind of weight throughout their life, because we also don't know that study looked at a lifetime of controlled intake. So those dogs were lean their entire lives, and they lived to be kind of 14, 15-year-old labs instead of 12, 13-year-old labs. So we don't know, do we see the same benefit if we have an overweight dog that then loses weight? We don't know, but we don't know that it doesn't help.
Right.
So in the absence of having these large population lifespan studies, we make the decisions that we can. So I would still encourage, if you have an overweight, kind of middle-aged dog, still encourage them to lose weight. We're learning the Dog Aging Project is looking at dogs. The Golden Retriever lifespan study, we're seeing some of the results coming out of that too. So I think this is an area we're going to learn more in the coming years. And I wouldn't be surprised if it gets that idea of just maintaining that lean body weight or helping animals reach the lean body weight is beneficial throughout their life. The second big category is protein intake. So we know that digestive function does decrease with age. It happens in dogs, it happens in laboratory rats and mice, it happens in people. So the little villi, those finger-like projections that increase surface area, start to blunt and they start to shorten over time and with age. Microbiome impacts that too. Fiber levels impact that too. So that's a kind of, looping the microbiome back into it. That all impacts your gut surface area and absorptive capacity. So if you have a decrease in surface area, you're going to have a decrease in digestion. So you need to make sure that we've got enough protein and high quality protein that it can be broken down into its amino acids and absorbed into the body. We know that older animals start to lose lean body mass as they get older. And that's a function of, potentially if they're not getting enough protein in their diet and protein's limiting, but it's largely because we see what's called the sarcopenia of aging.
Right.
So for those of us, unfortunately, who are over that kind of 40-year mark, humans start to lose lean body mass at about like 45. It starts to decrease. In our senior population, we tend to see it when they're a little, like kind of 8 to 10, depending on the breed. It just means that those myofibrils will start to break down faster than they rebuild. It's a normal function of aging. It just happens. And so what we can do to help maintain that is maintaining our activity levels in our pets, maintaining good, protein intakes. There's a lot of like the protein issue is a little bit controversial because there are some people who sit on the side of you need to feed a much higher protein intake in an adult or a senior dog compared to a standard adult, which could be true for some of them, but we have to balance that with some of the other organ systems that may be not working as well, like the kidneys or the liver.
Right.
And so it's always an individual. And I think, one of the kind of exciting conversations I think is happening in the field of nutrition right now is individualized nutrition and individualized medicine and medical care. And so we don't think of every senior dog is not exactly like every other senior dog. So we need to look at, what's their activity level, what's their life, their kind of normal expectations for life. Do they run? Do they jump? Do they do agility? Or are they couch potatoes? Do they have any compromise to kidney or liver where we're worried about their protein intake? Or can we kind of maybe bump it up and maybe increase their protein intake by 20 or 50% even as they get into those senior years to really optimize their intakes?
And I think that's been like a lot of the, that's entered the conversation more recently, as well as talking about, we're not just body condition scoring, we're muscle condition scoring and looking for the sarcopenia of aging and the things that go along with that to say, they can have muscle loss and still be overweight. And so how do you balance those things to create a healthy aging opportunity?
Yeah. Yeah. And so I think encouraging, absolutely encourage all veterinarians. And if you're working with support staff that help with some of the record keeping, making sure that everybody has a body condition and a muscle condition score so you can track it. So it's sometimes just being able to track it and recognize when it's changing is very important, because then you might be able to catch that, slight change. Maybe their weight stayed the same on the scale, but you've noticed they've got some epaxial muscle loss, which is very common in aging cats, especially. We start to lose some muscle mass in our cats, and sometimes it can be hard to detect because if they're an overweight cat, you may not necessarily notice when they start to lose their lean body mass. So you need to really be looking for it in our seniors.
Absolutely. So thinking about maintaining a healthy body weight, moderate calorie diet, protein levels, assuming that they can handle that from a kidney health standpoint.
Yeah, increase the protein.
Right.
The other big category is our fatty acids. So we've got all of the commercial diets across the spectrum are supplemented or have inherently higher levels of essential fatty acids. So our essential fatty acids are linoleic acid plus minus alpha linolenic acid. The reason I say plus minus is because we know that ALA is important. We just don't know the amount.
Okay.
Because it's hard to do an exclusion, like an exclusive feeding test where you eliminate linoleic acid without alpha linolenic acid. You can kind of come together. It's another side topic. But so we know that those fatty acids are important. So linoleic acid is an omega-6. Alpha linolenic is an omega-3. So we've got long chain omega-3s that are important for skin and coat health and normal immune function. So those are kind of our basics. So that's our basic kind of playing field. So we need to make sure every diet has that in it. As we get older, things like eicosapentaenoic acid, so EPA, and docosahexaenoic acid, or DHA, become important. So they're not essential for life. The cells will still function without them. The body has the ability to make small levels of these from those LA and LA precursors, just not very much. But we know that EPA helps decrease inflammation within the body. So you probably think about it from a joint perspective. So those older dogs that have osteoarthritis, we may be thinking about fish oil as a source of EPA to help reduce that inflammation. But DHA is what gets incorporated into the fatty coating of the nervous tissue. So myelin, brain tissue. And we know that one of the unfortunate features of aging is we start to lose myelin and we start to lose some kind of the brain atrophies. We start to lose some brain mass. So if we can provide those building blocks that the brain needs, we may be able to slow down some of those effects. So there were some really good studies coming out that came out probably about 20 to 25 years ago, looking at landmark discrimination, which was basically they trained beagle dogs on different tests, and they supplemented their diet with fish oil to provide EPA and DHA, as well as antioxidants to help protect, because the fat is very prone to oxidative damage. So you need to protect that fat, those healthy fats. So they supplemented fish oil and antioxidants and showed that at least in senior beagles, they had better retention of their learned behavior over the period of the year of that study, and had better visual acuity. They just were more interactive, more engaged with the world. So we know that, at least in some dogs, supplementing those longer chain omega-3 fatty acids, the EPA, DHA, can help support brain health. So that's another big category. So not necessarily all fat, but we need to have the right types of fats in the diet.
So much to think about in terms of, making sure that we're having conversations with pet owners about what they're feeding. Like I said, making sure we're getting that nutritional assessment when they come in for wellness exams, because and that's one of the reasons I love having these types of talks is there's a lot of opportunity for positive intervention. If we're having a conversation, it's not easy. None of us have enough time in the exam room. And we're always trying to figure out that hurdle. But when we do get the opportunity and we have an owner who is receptive and interested, I love gaining this knowledge, having these conversations, because I just see so much opportunity there to really benefit our patients.
Yeah. And I think, it's true. Like everyone, part of the, I tease a little bit that part of the reason I went into nutrition is because now I can have 30 to 60-minute appointments.
Sounds
instead
amazing.
Of, 15 to 20-minute. My life in GP was challenging because I wanted to have those conversations. I would build relationships with my clients so that they felt comfortable asking me anything, and any question they had, I would want to make sure that if I couldn't answer it right then and there, I would get back to them about it, which meant my days always ran over.
I was going to say that.
And my staff was like, come on, Dr. Weed, let's go. So, it was challenging, but I have the luxury of time in my appointment. So when I do, and I still do have private clients that I see. I have some clients that I've worked with for years who just we're now in the senior years of their dogs, and they don't want to lose that kind of trusted resource. So at least we feel as a trusted resource. So I still have those relationships. But even if you're a busy practice and you've got 10, 15 minutes, or maybe you've got the luxury of 20-minute appointments, this is where the support team comes in.
Absolutely.
And you can absolutely, there's always going to be wait time in a waiting room. So you can have your CSRs have a handout on a clipboard, or maybe you've got it on an iPad that the owner clicks through and it becomes part of the record. You may not be able to look at it right then and there, but maybe you've got a really enthusiastic technician who really loves nutrition and wants to take it upon themselves to scan through and make those notes in the record. That way you have the information. So it doesn't have to be you as the veterinarian who has to do it all. It's a team. I think of veterinary medicine as a team sport.
Yes. And I think that's another opportunity for positive impact of making sure that we are working together as a team, and that clients can get that information from multiple different sources, because sometimes they don't want to hear it from me. They'd rather hear it from somebody on my team.
And sometimes, especially asking the questions about supplements they may be giving, sometimes clients may not think of a supplement as a calorie source. So I had one client was a overweight Doberman who couldn't understand why she was restricting the food and the dog wasn't losing weight. And when we actually sat down and I had her fill out a diet history form and list everything that goes into your dog's mouth, the dog was getting 200 calories a day in supplements.
Wow.
200 calories a day in a dog that should only be eating about 1,400 calories was a lot. And it was the fish oil, and it was the coconut oil with the turmeric in it, and it was the glucosamine chew, and it was the dental chew. It was all of these things add up. And so having a way that the owners can report that to you and feel comfortable. Or they may be getting that recommendation from the specialty pet store or their friend at the dog park or the dog trainer or somebody else, and they may not tell you because it's not something you recommended. So I think it's always important to ask those questions about what else are you giving. So not just medications and diet, but what other supplements.
Yes, I've heard that phrasing before of what goes into your pet's mouth. List everything that goes into your pet's mouth because exactly, it might not come to mind as a calorie source or maybe nutrients that we need to know about. Thinking of continuing to monitor pets as they're getting older and look for signs that we need to intervene. Screening lab work is one of my very favorite things. I feel like I can get so much information from that. What are some of the key indicators that you're on the lookout for in pets to tell us we have the opportunity to make some changes nutritionally?
Yeah, so I'd love to hear you say that. In screening blood work, even if you think it's going to be normal, they're 8-year-old, 9-year-old, 10-year-old, no concerns whatsoever. And owners sometimes will push back. I'm like, he's healthy, he's fine. Why do I need to blood work? I'm like, that's great. We want to know how things look now. So if it changes in 6 months or changes in a year, we know at least at this point in time it was normal. What I'm looking for on the blood work and I look at trends more than I will like any one time point, especially for renal function. So we want to look at trends in creatinine, which is why it's important to have those healthy baselines. And, when they were younger, not just at the spay or neuter appointment, but maybe when they're 4 or 5, and then again when they're 6 or 7, or when they're 8, or sometime healthy older dog. Because you may find that when you did their blood work and their, creatinine level was 0.5 milligrams per deciliter when they were 2 years of age, and then you repeat it when they're 6 and now it's 1. Well, it's still within the normal range, but that's doubling. So 0.5 to 1. So is this a trend? And so maybe you have them come back, and instead of saying come back at 10, maybe we're going to come back in a year. And just see, is this just a fluctuation and a one-off and it goes back down to 0.8, or does it go from 1 to 1.2? So even though it's within the normal range, the reference range from the lab, it's an indicator that things are starting to change. And so now you have the opportunity to intervene earlier with diet. You don't have to go crazy and put them on a renal diet if their creatinine goes to 1.5, but you need to think about, well, now how much phosphorus is coming in from all sources, how much protein. If their BUNs are normal, then they're handling the protein level of the diet fine, unless they're proteinuric. So you also definitely want to get urine on these guys too. But maybe you don't necessarily need to make dramatic changes, but we talk to the owner about, this is something we're seeing, and setting them up for, in a few years, we may have to switch to that therapeutic diet, but we're going to keep an eye on this. The other aspect of the screening blood work I'll look at is lipemia.
Yes. I'm so glad you brought that up.
Yeah,
so I was going to ask about that.
That's a big one, because lipemia can be normal. So just lipemia is just that kind of milky white appearance that can show up on your serum. It'd be very normal after a meal. It takes about 6 to 8, sometimes 10 or 12 hours to fully clear, depending on the animal. So it could be a normal postprandial change, but labs are very non-specific when they talk about lipemia, and there is no correlation with the degree of lipemia and what the triglyceride levels are.
That's good to know.
So, and it's in the lipemia is triglyceride specific. Its cholesterol will not show up on the serum. It won't change the color. So it's going to be that triglyceride portion. What we don't know is that triglyceride coming from the diet as chylomicron, or is it coming from an endogenous production, like, the VLDLs or LDLs in the diet or in the body. So that's the first thing is there lipemia? Yes or no? If it's lipemia and I have a Yorkshire Terrier, any terrier really, a miniature Schnauzer, I'm looking for, now I want to know exactly what the triglyceride levels are. If it's a patient that has a history of being a little bit finicky with its food, maybe the owner's saying, he's just a picky dog, and you look back at blood work and he's always been lipemic, this could be a dog that's been having low-grade hypertriglyceridemia, potentially low-grade pancreatitis for years. Dogs are so stoic. They don't walk in with a sign. People with pancreatitis, when I've talked to clients who've had family members that have had pancreatitis, they're always impressed that their dog is not acting sick, because the human in their life that had this disease was in the hospital for weeks on like morphine drips because it was so painful. And the dog's just like, I'm just going to sleep under the chair for a little bit longer. So we want to look at, is there a lipemia there? And if it's persistent, we want to get that triglyceride level measured.
It's interesting because I feel like that is one area where we can really intervene. I'm thinking of, it was 2 patients, and the diet that they were eating was high in fat. And it was, we got a high resting triglyceride level, and we changed to a lower fat version, and it back to normal. It was, so yeah, I've seen that one firsthand, that making those changes can have a really dramatic impact. And like I said, reduce their risk for pancreatitis, especially when we're talking about one of those really prone breeds.
Yeah. And it's not every dog. There are a lot of dogs. There are a lot of, higher fat. Like if you look at the spectrum of fat in commercial pet foods, it's anywhere from probably about 20% of the calories up to about 50% of the calories. And there are older dogs, especially larger breeds, that handle higher fat diets without a problem. The nice thing about having a higher fat diet is it increases the calorie density. So we talked about weight gain with age, but we didn't talk about the senior dogs who may lose weight. And some of that can be they're not as active, so just the energy requirements have gone down and they're not eating as much. There's a lot of physiologic changes that happen with aging that can slow down gastric motility and gastric emptying. So now they're just feeling full and they just don't feel as hungry, even in Labradors. My Labradors, it was like age 12, 13 is when they stopped being just like a walking stomach,
Right.
really. But it does change in that kind of more geriatric population. And so having a higher fat diet increases the calorie density. So now we can get the same amount of calories in a smaller package. So you just don't have to physically eat as much, which is nice. Fat is palatable, relatively easy to digest. So it has a lot of good features for an older dog. We just have to make sure that we're matching dog and diet together.
And that kind of segues into my next question perfectly. If you were to ask me what's in a senior diet, I'd say, it's probably lower protein and higher fat and probably somewhat moderate calorie to a point. Is there like a universal truth
It's
to
not.
that?
I would say that description of senior diet is true for some brands, but not all.
Sure.
That's one of the biggest challenges is that senior diet, there is no specific definition or legal requirements for what goes into a senior diet. So really senior diet's more of a marketing term and is up to the individual company on how they interpret that. And so there are some senior diets that have higher protein, are more digestible to account for those changes in digestion that can happen and to help maintain lean body mass. And dogs like protein and fat, so it helps maintain palatability too. And then there are some diets that may have a lower protein to your, kind of your thoughts about it or kind of what you have on your mind is what a senior diet is, because there are some companies that assume a dog has kidney disease, undiagnosed kidney disease until proven otherwise. And so they may reduce the amount of protein in the diet. I'm not a fan of reducing protein just because they're a senior unless I've got some underlying renal pathology. So if they've got proteinuria, if they're azotemic and we're seeing those changes, then I would want to reduce protein. But even then, I'm reducing from what they're currently eating to something below that. The exception being if they're proteinuric, you have to bring them down to renal diet levels. But if they're just azotemic, if it's those age-related changes that happen with the kidneys and there's no proteinuria, then if they're on a higher protein diet, we just want to bring them down to a moderate protein. And so we just need to reduce a little bit, kind of alleviate the workload of the kidneys, still meeting their protein needs, still meeting, that digestible bioavailable protein source. And then we reassess. And if we have to go lower, we do. So senior diets, every bag, every package is going to be different depending on the company. And so that's why it's important to really have a good evaluation and assessment of that senior patient that you're seeing to know kind of where do they fall and what's the right diet for them. And it might be the exact same diet they're eating. It might be no change.
Which would be ideal. But, if someone were to say, oh, I'm feeding a senior diet, I think I would have an assumption about that. And so I feel like that's really good information to have to say, okay, well, we may need to dig in a little bit and see what is this particular brand concerned about with seniors and what alterations, if any, are they making for this. This is, I'm thinking about some of the things you said where, what level of protein and is it digestible and bioavailable? and these things. I mean, it's a lot to absorb as veterinarians, veterinary professionals. How do you talk to clients about this?
So I usually talk to clients about diet is, I think about diet as a way to get nutrients into the body. So food is just the vehicle. At the end of the day, we need amino acids, we need essential fatty acids, things like calcium, zinc, iodine. You need the right minerals, the right vitamins in the right amounts. And so I'm thinking about diet as what form does that dog like to eat? If I have an owner that comes to me and they say, I've got a senior pet and they're getting a little bit picky and I have to switch to a home prepared diet, I would want a little bit more information about the owner's lifestyle before we start talking about the dog, because that's a big commitment. And we need to make sure that we're meeting those essential needs, whatever form that is. And then we look at, okay, if we've got all the options, what does your individual dog need? So maybe we do the screening blood work. Everything is within the normal range. It's been pretty consistent year to year. We don't have any major red flags. So maybe we're talking about, let's look at, do we add fish oil, say, for those long chain omega-3 fatty acids to help support brain health with aging? Do we need to think about antioxidant supplements? Do we need to think about things like glucosamine, chondroitin, which have the clinical studies on glucosamine, chondroitin for dogs that have arthritis are pretty underwhelming. Basically no different than placebo, but potentially there's a role for them to help prevent cartilage degradation. Maybe we should be thinking of it more as a protective rather than a treatment. And so I usually talk to owners about let's make sure we're meeting all of their known essential nutrient needs, and then how do we modify diet or supplements to optimize and help support those systems, knowing all of the challenges that age is going to bring. I don't know if I answered your question.
No, it did. I'm reflecting on, having this conversation, and I would imagine, I feel like there's a lot of pet owners who are very receptive to that sort of, I'm not everybody, but I think we have a population that's receptive to that conversation, because we all want our pets around for a long time. Most of us do, I guess, depending on your pet, but I want mine around for a long time. And
I mean, it depends. When my one dog wakes me up at 4:30 for breakfast, sometimes I'm like, maybe someone else, you'd be better in someone else's home.
Yeah.
And then he snuggles up next to me and I'm like, okay.
And okay. Yes. At 4 a.m, yes, I think I would have those same thoughts. Let's think about this. But I kind of like we talked about earlier, the fact that we're having this conversation, the fact that we're having this type of a conversation with pet owners, where I don't know that we were having this same type of conversation 10 years ago. There's been this massive shift in the conversation around nutrition. At least it feels that way to me. And so I guess I'm curious, what do you see for the future?
The future, I think we're going to look more at just individualized nutrition. And I think there is going to be, I mean, as a nutritionist, I formulated a lot of home prepared diets, and I've had a lot of patients that have done very well in home prepared diets, but I would not recommend them as this is the end all be all. I mean, I think that is the ultimate in individualized nutrition, is now you've got exactly the right calories. We can fortify nutrients to make sure on a metabolic body weight, we're meeting all of those needs. We can select the ingredients. The owner can source the freshness and they have ultimate control. That takes a lot of work.
Yes.
And it takes a lot of commitment and dedication from those pet parents.
And I have a hard time cooking for myself. When I think of cooking for my dog.
Even me, I know I should be taking vitamin D and fish oil on a regular basis. And I put them in a pill case and I can see exactly how many days I didn't take them at the end of the week. But now I'm responsible for this other life.
Mm-hmm.
And so if it's, for me, vitamin D is essential. Fish oil is not. So if I leave the fish oil out, okay. If I do that for my dog and I'm leaving the calcium or the iodine or the selenium out, now I'm impacting their metabolism. I'm impacting their immune function. And so am I now setting them up for problems in the future that I just don't anticipate? Because it's really easy to create an imbalanced home prepared diet and not cause immediate harm. But it takes some effort to do it right. And some people just have a hard time putting that effort in.
Yeah.
Tangent. I digressed on that. But so really looking at the future is looking at how do we optimize nutrition? And so I think individualized nutrition is one extreme. And then even for human nutrition, I'm kind of very interested in human nutrition. And that's really the trend on the human side, is looking at how do you optimize for your individual biology, physiology, what you're taking. For dogs, I think we're moving past just meeting minimum requirements, and we're looking at how do we optimize diet. The early kind of starts of the pet food industry 100+ years ago was just meeting minimum requirements. Can we provide calories? Can we provide the essential nutrients that we know about? Because 100 years ago, we didn't have all of them identified yet. Taurine wasn't a known essential nutrient for cats until the 1980s.
Wow.
And so there's a lot that we're still learning. And I think as we learn more, I think it's really looking at that optimal health and nutrition. And so some of that's going to get incorporated into commercial pet foods, and some of that may be supplements that we add on, and things that, and the way that we think about diet as, again, supporting health, not just when we need it at the end, but at the beginning, to try to really give that animal the best chance for that long, healthy life.
That's exciting.
Yeah, I'm excited.
Yeah, to think about all of the chances to optimize things and create longevity and healthy aging. Look,
Healthy
we circled
aging
right
and-
back around. I didn't even say that on purpose.
Yeah. and how encourage veterinarians and your care team to have the conversation.
Yeah.
So for me, that's the most exciting aspect of the future, is that we're having the conversations about nutrition and we're incorporating that into our practice. I love going to other lectures about, random topics, not necessarily nutrition related, and having the presenter bring in nutrition. Like, it makes me feel good that we're having nutrition conversations in every aspect of veterinary care, because it's so important. Everything is nutritional biochemistry. Like, everything comes down to the nutrients at the right levels and the right amounts.
I have thoroughly enjoyed this conversation and learned a lot. Thank you so much.
Thank you for having me. Thank you, everyone who came live for this session.
Yes. Before we open it up for questions, any final thoughts you want to share?
No, just keep having those conversations about nutrition.
Such a good place to leave it. Well, and yeah, we can open it up to questions.
I'm also very interested in nutrition. And I just recently started practice, so I'm hoping to grow into you one day. But you said that we have to change our recommendations based on the individual patient. Now, how do you go about doing that? Because I know that when you look at the ingredients and the product label on the back of the
Eating guide.
yes, the eating guide, that, percentage of crude fat doesn't always equal what's actually in it and stuff. So what's that first step to making those changes and changing the diet for a specific pet?
So I think it starts with asking what they're currently eating. So knowing how to change, if a change is needed, it's important to know where you're starting. So getting the information on the diet itself. Is it a complete and balanced diet? Are they eating a lot of treats, and so maybe less mealtime food, and they're getting more than about 10% of their intake from kind of non-meal calories? So I think first is just kind of knowing where we're at with that individual patient. So what is their intake? What percentage of their diet is coming from a complete and balanced meal versus additional treats and snacks or chew toys? And then looking to see if a modification is needed. So if you have a healthy adult dog, a healthy senior dog, and they're eating, 85-90% of their intake is coming from their 2 or 3 main meals, and they're getting a little bit of treats along the way for training and enrichment, and they're a good body weight, I would be hard pressed to change the diet unless there was a medical indication. So for me, a medical indication is they're eating a diet that is potentially harmful. I am not a raw food feeder. I know there are topics, that's a whole other topic. I worry about food safety for pets and people. That's my biggest concern with an uncooked meat source. And then if we're looking at diets that maybe this individual breed has a predisposition. So if it's a 2-year-old miniature schnauzer, they are often not hyperlipidemic. It usually shows up sometime around 3 or 4. So maybe we're thinking about, well, this is a relatively high-fat diet, and we're okay now, but maybe we want to have the conversation with the owner. Like, we might want to consider switching to a lower fat diet just because we don't know what the future brings. We don't have a good genetic test that I'm aware of to screen those at-risk breeds for hypertriglyceridemia before we physically see it. So I think just having the conversation, what are they eating right now? Do we even need to change? If they're on a healthy maintenance diet and they're a good body weight and eating the right amounts, then and the diet itself isn't harmful to anyone, and then I would just keep them on what they're currently eating.
So I know you mentioned, keeping a good body weight, protein, the fish oils and everything. Uh, and I know this may vary, between patients, but is there maybe any studies that you can reference? Is there any benefits of giving senior pets like a daily prebiotic and postbiotic?
I mean, so the question, if I heard it, because it's a little bit noisy, so if I heard the question was, is there a benefit to giving a prebiotic or a postbiotic as a part of kind of like healthy aging and healthy support? Potentially, there is. I don't know that every adult animal needs to be on probiotics, but definitely if we've had an adult animal that's had antibiotics at time points during its lifetime, potentially we need to provide some beneficial bacteria. It can support gastrointestinal health, especially in dogs that maybe those like sensitive, they always say sensitive stomach, but they're really just having diarrhea. So it's really sensitive colon, I guess. So, potentially if you have a patient who has a history of like intermittent stool quality, adding a probiotic may help just support that microbiome population. The one caveat to always remember with probiotics, so these healthy bacterial or yeast species, is that none of them are canine specific. Well, there's animal biome is canine specific, but most of them are strains from people that have been repackaged and used. Even things like Fortiflora was developed for infants, preterm infants, and then it works really well for puppies and kittens and some dogs and cats, older dogs and cats. Visbiome was is still my favorite probiotic for dogs that have more chronic enteropathies. It's a much higher concentration multi-strain. It's marketed for pets because people were using it off-label in their dogs with chronic enteropathies or patients with chronic enteropathies, and there were some clinical trials published looking at the benefits of that high-strain probiotic supporting gut integrity better. And even things like the clinical trials on, this is not to be a Visbiome commercial, but the clinical trials on Visbiome show that it can be as effective as low-dose steroid for some dogs because again, those bacteria are not necessarily creating compounds, but they're interacting with the gut ecosystem in such a way that it stimulates some healthy production of some cytokines and compounds that will improve integrity of the gastrointestinal tract and function of the gastrointestinal tract. So it's a long answer for your short question is maybe. Generally, probiotics are not considered harmful. The issue you may run into if you give a probiotic to a patient that doesn't need one or doesn't tolerate certain bacterial strains is you may make them gassy or give them a little bit looser stool. If that happens, because these are not bacteria that are adapted to life in the gut's digestive system, they'll be pooped out within 3 days. So I feel like it has a really pretty low harm threshold. So if you start probiotics and the dog gets looser stool, leave it out. If you start probiotics and the dog gets really gassy and the owner's like, I can't do this anymore, then leave it out. But, we don't know if low-dose probiotics starting at, age 8 helps prevent some chronic enteropathies as they get older. We just don't know. So I think of it as not harmful, maybe helpful.
Universal answer to medicine. It depends.
Yeah, it depends. Everything. I feel like that's nutrition in general. Like maybe. Thank you, Cassie.
Yeah. Oh my goodness.
Thank you, audience, for staying.
Yeah, you guys were great. Like I said before, I definitely want to reiterate, thank you so much to everyone who joined us for this conversation live at VMX. Hope, if you're tuning in again, like I said, I felt like this conversation was kind of dense. So a lot of information to glean from it certainly may bear listening to more than once. Thank you to Fresh Pet for making this episode possible. And of course, thank you to Dr. Weith for being such an amazing guest. I truly enjoyed the conversation and hope we can do it again sometime. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcast to help other veterinary professionals like you find this and other great content we try to put out there. For more episodes like this, you can click on the education tab on the Vetfolio website or find us wherever you get your podcasts. As always, love to hear from you. I want to hear your thoughts on this episode, ideas for topics you'd like to hear from us in the future. So feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassie DVM, or we can connect on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.